Hello and welcome back to the Tired Truth podcast. I'm going to be so honest and say that I am freaking exhausted right now. I don't know what is going on. I just feel like maybe I'm been doing too much recently. I don't know. Sometimes fall kind of gets you, so maybe it's fall. I don't know, but I've been so exhausted recently, so we're trying our best. We're here filming, but we'll see. Who knows how long I'm gonna make it, okay? So I've talked a lot about, all of the things that are wrong with me, right? But I really wanted to, dive in deep into MALS because I feel like there's not enough representation about it, about what it is, symptoms, diagnosis, everything like that. So this is going to be a full-blown MALS podcast. If you don't have MALS, sorry, watch the next episode. Okay, so before I get into my story and everything around MALS, I feel like I first have to define it because I didn't even know what this condition was. So MALS stands for Median Arcuate Ligament Syndrome. And it's a condition where the median arcuate ligament, which is a band of tissue right near your diaphragm, is compressed by the celiac artery. So in normal people, and I hate to say normal, but for the people who don't have MALS, their median arcuate ligament just kind of chills near their celiac artery. But for people with MALS, that is super compressed by that celiac artery, so it's constricting blood flow and causing all of these lovely symptoms. The main one is chronic upper abdominal pain. So, and this occurs especially after eating. So after you eat, you're automatically in this crazy excruciating upper abdominal pain. It's not your lower stomach, it's your very upper stomach, almost right under your ribs. At least that's how it was for me. And things like nausea, vomiting, weight loss just because you're not eating, and feeling full really quickly are common symptoms of MALS. So when you look at these symptoms, so many of them are consistent with other stomach issues, and as we probably all know, GI doctors low-key suck, and so trying to get an accurate diagnosis is really difficult to do. So I kind of wanted to just go through everything that I went through. So if you're going through similar things, you might be oh, maybe this is MALS. My dog has decided to play with his duck right now. This is not the time. This is sleeping time. What are we doing? Good job. Good job. Thanks. Oh, thanks. Okay, so basically MALS is something that you're born with. And when I think back, I've never had a healthy relationship with eating. Struggled with celiac and all kinds of puking things. I'm the pro puker because I've been throwing up since I was in the first grade. Anyways, so this is something that I know that I've dealt with my whole life, but it didn't really become such a horrible problem until a couple years ago. And I'm not really sure why. I ended up getting the flu really bad, and it kind of made a lot of my symptoms worse. So I kind of suspect that that's kind of what set this off, but obviously I'm not exactly sure what made the flip that it was oh my god, this is so bad. So anyways, got the flu. This was 2022, and then after that, every time I would eat, I would get in this crazy upper abdominal pain. And pain to the point of going to the emergency room because I thought something had exploded, my pancreas had ruptured or something. That's how bad the pain was, laying in the fetal position, trying to breathe because it hurts so bad, that type of pain. And again, I've lived with stomach issues my whole life, and so I'm this is not my stomach isn't upset, my stomach isn't in pain. There's something else that's causing this pain, because again, it's right under your ribs. When you push on it, it hurts more. It hurts to breathe, just this aching, horrible, stabbing pain. And when it gets really bad, I wasn't able to stand up straight. And even my posture's just consistently gotten worse, once this pain kind of showed up. But when it's really bad, literally walking with a hunchback because I could not. It would hurt so much worse to sit up. So that's just kind of describing the pain. So And obviously, it's really frustrating and confusing and not awesome when every time you eat, you end up in like crazy, crazy pain, because it kind of like creates this like fear of food. And this is not like, I'm not talking like eating disorder fear of food. Like, like I was scared to eat because I knew it would put me in pain. And it didn't matter what I would eat. I tried a liquid diet. I tried, like the low FODMAP. I'm already gluten free. I tried small meals. I tried literally anything. Anything I would eat would put me in pain. So obviously I started to try and see a doctor, and the first step I took was to get a endoscopy done, so get a scope done where they stick a camera down your throat, to see what's going on in there. This was like easy breezy for me. I think this was like my 5th scope, so it was like not a big deal. They just like knock you out and stick a tube down your throat and it's a-okay. But that came back normal. So then I had to get a gastric emptying study done. This was a little interesting. So a gastric emptying study is to look at a condition called gastroparesis, which is basically just like your stomach not being able to digest food. Like it's basically just like a slow paralyzed stomach, which obviously is not a great thing. So a gastric emptying study is a medical test that's used to see how quickly food leaves your stomach and moves into your small intestine. So I had to wake up so flippin' early for this test, which I think when you have POTS, like it's the worst thing to wake up early. Like we should not let POTS patients take the like 7 a.m. appointment. It's like, why can't we like reserve some for later, Anyways, so I show up at the clinic and they make you eat like this meal. And online right here it says a small meal. Bitch, this was not a small meal, okay? I had to eat eggs. I think it was like 1 or 2 like full eggs, which that alone at the time I was like, that's a lot of food. Like I can't freaking do that. And then I was supposed to eat 2 pieces of toast, which had to be gluten-free toast because of me. So I ate that, and then I literally drank this thing of like apple juice that had mixed in literal radioactive material into it. And that again was like so hard for me because I like can't chug fluids. I can't like, and so they had to have me like chug this like apple juice that tasted terrible because it was literally radioactive. And I was just like, I'm gonna hurl. So that was really hard once I like got all that down. And then it's down, and then you're like, okay, I can't puke this up right now. So then you like stay there for hours, literally like 4 to 6 hours, I think. And they take like x-ray pictures of your stomach throughout the time that you're there. So ChatGPT says that you lie under a gamma ray camera which takes pictures of your stomach at set intervals, usually 0, 1, 2, and 4 hours after eating. I think I remember doing it more frequently than that. But yeah, so again, they're just like measuring how much food leaves your stomach and at what pace. So normally about half of the food should leave your stomach within 90 to 120 minutes, and then less than 10% should remain after the 4 hours. And when we look at my study, I had like mildly slow emptying at the start. So like my stomach was slow at the start, but then it ended up like emptying relatively normally towards the end. And so it was like you might have mild gastroparesis, but like this shouldn't be causing all of this. Like you really, like basically it's like it was relatively normal. This isn't the issue. Okay, so now obviously I'm kind of like at a loss of what to do because doctors are at a loss of what to do because again, GI doctors don't do their jobs. So at this point I've lost an insane amount of weight. Okay, not really. I lost like 15, 20 pounds. And had literally no energy at all. My hair was falling out because I was like so malnourished because like I couldn't eat anything. I had like the worst acne ever because my body was just like throwing a fit. I was just like falling apart. So pale. So I did not look too good, did not feel good. Just a hot mess. So I ended up moving back home so I could get some more help. And I've said this before, but I want to say it again. I ended up going to coffee with like literally like this long lost friend. I went to elementary school with her, and then we both kind of like went our separate ways. She has POTS, didn't know this. We end up getting coffee and like talk about our lives. And she starts telling me how she recently just had this surgery because she had this terrible upper abdominal pain, and that every time she would eat, she was in pain. And she was like, yeah, it's called MALS. And right then and there, I was like, excuse me, what? What is this? So that's the first time I ever heard of this. No GI doctor, nobody had ever mentioned it before. So literally after that moment, I was like, I think this is what's wrong with me. Like, I need to find a doctor. I need to find somebody who can look into this for me. She tried to refer me to her doctor, but he wasn't taking any patients. Surprise, surprise. So I tried to go through like my normal like insurance place that I usually like go through. Saw, I think, maybe 2 or 3 GI doctors. One of them tried to just put me on antidepressants. Surprise, surprise. I said no. Another one flat out told me MALS doesn't exist. I think the last one said MALS might exist, but we don't treat it in our entire facility, which is like the entire state that I live in. So they were like, good freaking luck. And both of them sent me to a nutritionist. And thankfully, the nutritionist was like, I don't really know how to help you because if you can't eat anything, like you can't really like build your nutrition. But I was like at a point where they were like considering a feeding tube for me, that they were like, girl, you really got to eat or we're going to like shove a tube down your throat. So it was like getting to the point where it was like, this really needs to be solved. And even just like mentally, I was losing my freaking mind when you're in that much pain every day. Like, obviously that's hard to deal with. And the other thing is like, nothing would help the pain, like literally nothing at all. I tried a bunch of different medications, nothing. So I ended up that I would just put like a lidocaine patch like right like where your diaphragm is basically, and that wouldn't help the pain, but it would kind of distract from it, and then you're kind of like thinking of like the burning sensation and less of like the actual pain sensation. But there was nothing that could help get rid of the pain entirely. So I end up reaching out to my friend again, and she refers me to another doctor who she got her actual surgery from, which is different than the doctor she was seeing. And so I flat out just made an appointment with that doctor, didn't have a referral, didn't have anything. And he was just a like general surgeon, but I was like, I need to see this man. Okay. And before I went to the doctor, he wanted me to get a couple tests done. Okay, so I got a CT done with contrast to look at the compression in my stomach. So did that. Also, the person who did it wrong, so I had to do it again. So again, that's like just like all the little things that like are barriers to like getting a diagnosis. Like even if somebody does order a CT, you might have somebody who doesn't know what they're doing. So like you have to know every step of the way that someone is qualified to be able to do their job, which is like kind of mind-blowing that like, you know, you'd think somebody who's running and performing the test would know how to do their job, but apparently not. Okay. So I got the CT done, came back relatively-ish normal. At least that's what the, radiologist said. Then I went and got an ultrasound done. What's it called? A Doppler ultrasound? Is that what it's called? Yeah. So again, to look at like the compression of the celiac artery, that was like one of the most like traumatizing tests ever, because I am like, like almost praying that like I do have this condition because it can be fixed and that I know what's wrong with me. And the tech that was like doing it flat out at the end of it was like, well, you don't have MALS, so you are lucky because you don't want this condition. So went home crying after that. Anyways, and then the final thing that I got was a nerve block. Okay, so this nerve block is, they literally stick 2 gigantic needles from your back all the way to your celiac plexus, and then put in basically just kind of like this numbing medication that like literally blocks the nerve so you can't feel anything from there. This was really painful, which I was like, I was expecting, but it was like not like wow. And it was almost like more painful afterwards, because it was just like my back was so incredibly like sore and in pain. But anyways, I would do it again because it's freaking worth it. Okay. Because this got me my diagnosis. After I got the block, I went straight to Chick-fil-A and I ordered a fat gluten-free chicken sandwich, a large Sprite, and some French fries. And I ate the whole thing. And I have never done that in my entire life. And my mom and I were baffled. And so that alone was like a really good, my dog is killing me. So that alone was like a really good indication that like MALS was probably an issue. So this was all before seeing that doctor, but unfortunately the nerve block only lasts like 24 hours. So it's like kind of crazy that like you go through all this pain just to be like, "Oh, it's over," you know. So I like ate one meal and then by the time like I ate another one, I was like, "Oh, it hurts again." But anyways, I went and saw his doctor, and I will literally never ever forget this appointment. Um I have never felt so validated as a person with complex conditions. I think everybody who sees doctors when you're chronically ill, you have some type of medical trauma, okay? Doctors need more patient care training because, dear God, are they terrible at it. I walked into that appointment and he understood what was going on. He understood the pain that I was in. He validated my symptoms, answered all of our questions, and flat out was like, "You probably have MALS." Um, and I went with my mom, and I remember my mom just like bawling her eyes out next to me because it was the first time that a doctor like actually listened to me. Like, we have gone through so much and gone through so many different doctors and tests trying to figure out what was going on. And it was like the first indication of like something is wrong with you and we know what's going on and we want to help you. You know, I've had so many doctors flat out be like, "I'm not going to help you," that like seeing a doctor that's like, "Yeah, let's figure out what's going on," is like so incredibly validating and just like so emotional, which again is mind-blowing. Like, what do you mean like I see most doctors and expect them not to help me? Like, that is just like absolutely pathetic. But at the same time, like, I get it because you don't know what you're doing, but it's like, hello, can you know what you're doing? Ugh. Anyways, so the tricky thing about me and this surgery was it wasn't like definitive you have MALS through my testing. My CT scan, my diaphragm like sat lower than it should, and my ultrasound was like relatively normal, but my nerve block was obviously very positive. And so he was like, "There's probably like an 85 to 90% chance that this surgery is going to work, but there's also a chance that it might not." So obviously that's like really concerning and like kind of hard to like battle with in your mind to see what you're gonna do. But I was really at a point where it's like, I don't know what else to do. Like, I've exhausted every option and I cannot live like this any longer because at this point it had almost been 3 years. So I ultimately decided to get the surgery, and the surgery is they went in laparoscopically. So I have like 6 incisions, for like cameras, and then obviously they're like fun little tools and stuff, and they go in there and they kind of like release that median arcuate ligament, so they kind of cut back that ligament. And then the surgeon that I went to, who is like world renowned because like he's like the best at this, he cuts out like the surrounding nerves around it, which a lot of like MALS doctors don't do. So he just takes that like extra step to make sure that like the surgery is like really gonna work, because again, if there's no nerve surrounding it, like it's less likely that you're gonna like produce pain there. So I'm gonna talk about surgery recovery because I had no idea what I was in for. Again, because there's no representation of this online, on the internet, anywhere. So I'm gonna be like so brutally honest. If you don't want the honest truth, don't watch this. Do you live with a chronic illness and want to connect with people who truly get it? Check out Chronically Connected, an app created just for people with chronic conditions. Think of it as a giant group chat where everyone understands what you're going through. We have weekly prompts to spark real conversations. It's a safe space to ask questions and share experiences, and build connections with people who truly get life with a chronic illness. It's simple. Click the link in the description to join. Just make sure you upload a profile picture so we know you're real. So I knew before going into surgery that I was going to spend at least one night at the hospital. He makes everybody just spend at least one night. So I was prepared for that. Showed up, you know, in cute little braids with my little like overnight bag, like, woohoo, let's do this. And I woke up from surgery and the first thing I said was, "Is this MALS?" Like, I looked at my mother and was like, "Did I have MALS? Is that what is going on?" And she looked at me and started crying, and I started crying, and she was like, "Yeah, it was MALS, like you had MALS." And that alone was like so validating and so worth the surgery and everything that like I had been going through, just to like have a clear definition of like, this is what is going on. Because when you're in the chronic illness world, a diagnosis is such a privilege, and to get that diagnosis was just like, oh my God, thank the Lord, you know? But as anesthesia started to wear off and stuff, the pain really started, and I was really in so much pain. Thankfully, they did do like a nerve block on my like abdomen wall when they did the surgery, so I couldn't feel a lot. But even then, I was in a lot of pain. And when I was in the hospital, it was almost that like my back hurt more than my front. I think because of the nerve block, but also because like where they were performing the surgery was like so deep inside of my abdomen wall that like it was like, I think the pain was like referring more to my back just because like that's where things were happening. So I couldn't sit up by myself. The first time I sat up, I had to have somebody help me. I got better at, like rolling to the side and then kind of like pushing with your arm to sit up. But I was incredibly bloated because they blow your stomach up with CO2, so they're able to kind of like see inside and see everything. So my stomach was really full. I obviously had all these like little incision marks that they had stitched up, but then covered with like this like literally like weird like super glue on top of it. But I was on a steady stream of like hard medication, like hard opioids, for a hot minute. And I could not have gotten through those first like week without that, if that kind of tells you like how much pain I was really in. Another thing that I thought was really odd at the hospital was for the first maybe like 24 hours, like I really like struggled to pee, which is like low-key graphic and terrible, but it was like kind of concerning to me, especially because I'm like, I don't know why, but I'm like scared of like catheters, and I was like, this is the last thing that I want. And so I think it was mainly because they did do that like nerve block, and so like everything was just kind of like numb, so like my body couldn't really like pee, but it was like I had to pee, my bladder was full, but like I couldn't pee, like, so I was eventually able to, and it was a-okay, but just maybe like a warning sign, just like to be prepared for, I spent that first night in the hospital, and honestly, I was pretty miserable. I didn't sleep a lot, just because I was in so much pain. But I didn't know this. When you go to the hospital and you're on like heavy medications, I don't know if I can say the word opioids on YouTube, so I'm just gonna continue to say medication. When you're on like such hard medications, you have to ask for them, which I was not aware of, because like every 4 hours I could take more, but if I didn't like call the nurse and say, hey, I want more, they wouldn't bring me any more, which I thought was like very odd. So I was like continuously like throughout the entire night, it'd be like 1 a.m, and then it'd be like 4 a.m, and I'd be like, hey guys, can you give me some more? So pretty crazy. But then once those like kicked in, it definitely totally made me feel better, especially when I did like double the dosage, because then it was like, wow, I am feeling all right, So if you do the surgery, like you're gonna get through it, like it's gonna be okay, but like just like I think to prepare yourself is kind of a good thing, because I didn't really know what I was going in for. So I spent the night in the hospital, and then I was considering spending another night, and I literally asked the nurse, I was like, so you're telling me like I'm either gonna be miserable here or I can be miserable at home? And she was kind of like, well, yeah, because like I was able to like get the medications at home. So I was kind of like, let's go home. Like I'd rather like lay in my bed than be in this hospital bed, So I decided to leave after a day and a half. I still think that was a good decision for me. Maybe it would have been nice to be like on more drugs, but I mean, I was still in a ton of pain either way, that it was kind of like nice to like be in like a comforting bed. I will say I slept in my parents' bed, because they have like one of those like ones that like sit up and sit back, because I could not lay flat at all, like literally at all. So I had my head all the way up, and then I had my feet all the way up. So I was in like this little like almost like cocoon little position, and I couldn't lay flat for literally probably like 2 months. I feel like it's just recently that I've like been able to. And even at that, I always sleep elevated, so I don't even know if like flat is really a thing. But I do think another thing to note is I had crazy swelling that I was not prepared for, okay? And maybe this isn't the case for everyone, but it sure as hell was the case for me. My swelling continued to get worse as I left the hospital. I think it was day 5 or 6. I couldn't put any of my pants on. Like, my pants would not fit because my stomach was so swollen. And that is like really painful. Like, it was just like such tightness. Like, I was like, oh my God, is this what it feels like to be pregnant? Because I don't want this. It was just so tight and painful and terrible. We even called the hospital and was like, is something wrong? Like, why is my stomach so swollen? But it did slowly start to go away. I will say, I don't even think now I'm like back to normal, and I'm like 3.5 months post-op. Just the swelling, and I noticed that some days I'm like more swollen and bloated than other days. So I think things are just like still trying to figure themselves out, but I'm nowhere near what I looked like. It was like scary. Like, I didn't even look real. It was freaky. But the pain did not go away. That first week, I'm not gonna lie, it was pretty brutal. Steady medication on Advil and Tylenol, back to back. And then that first week, I was on some opioids, which, girl, I needed. Also, they only give you like a limited amount, which is good. And so I was like trying to ration them so I could like get through the week. And my mother informed me that we could have called and gotten more. And I was like, are you kidding? Like, that week, I would have loved to just be like out for the count, like high as a kite for a week, because I was so miserable. So you can get more medication. I was not aware of this. Obviously, we're not trying to abuse hard drugs, but anyways. Speaking of the pain, again, I was still in so much pain. I really could not sit up myself. Probably took me like a month-ish, maybe more, to be able to like even like start to use your abdominal muscles. I think you don't realize how much you use your stomach until like you can't use it. So like it even hurt to breathe. It hurt to talk because you do use those muscles, and especially because the surgery was right by my diaphragm. Like, anytime you're breathing, like, you're using your diaphragm, and that's really hurting. Another thing, it really hurt to laugh, obviously. When I was like on copious amounts of medication, I thought things were really funny, and I think a lot of times when I deal with pain, I deal with it through laughter. And so there were so many times that I was like, Mother, you need to leave this room right now. Like, I can't stop laughing. This hurts so bad. And I would just like hold a pillow and be like, oh my God, don't laugh, because it was just like, it was painful. Anyways, another thing to really note is, and this is so graphic, but the first few weeks, maybe even like a month, I don't know, maybe more, I don't know, I've blocked it out. I had the world's worst gas issues, okay? And when I tell you room clearing, horrific, okay? And it was like every night, like clockwork, it would like come up, and it was so bad, but like I couldn't help it. I couldn't stop. So just, I don't know, be in a comfortable environment, and be prepared, okay? Maybe get some Febreze, but I couldn't handle the Febreze because it was like, oh my God, then I can't breathe because it was like this, the chemicals of the Febreze, So, again, you might be clearing rooms, right? And that's okay, And I think another issue is like I really could not get my bowels regulated. I think firstly, because when you are on like more harder medications, it can really lead to constipation. So I was like on a steady stream of like Miralax, but then even with that, it would either be like absolutely nothing or it would be like water. That's horrible. So I really struggled to like find the in between. I think also it was just struggle to like have a bowel movement in general, solely because I could not use my abdominal muscles, and so I could not kind of like bear down like at all to be able to move things. It was an issue, and low-key I moved towards the looser area just so I was able to like keep things moving, because when I wasn't, like, I couldn't like push at all. So just to like be prepared for that too. Another issue, I was so incredibly nauseous. I think like day 2 and 3 were like my worst. Well, maybe not. It's still pretty bad. I was so nauseous, and the last thing you want to do is throw up, obviously. So I was constantly sniffing alcohol wipes. I was taking, chewing gum. I was popping mints. I was deep breathing. I was doing everything in my power not to throw up, and thankfully I never did. But nausea was a big issue for me. And I also just like didn't really want to eat a lot. I think a kind of like a common misconception is you think that after your surgery that like you're gonna be like, oh, boom, and you're gonna feel better and you're gonna want to eat, and that like was not the case at all for me. I ate Cheerios and plain tofu for a long time, and just small little meals. I had like plain rice, and I was just did not want to eat. Nothing sounded good. But when I did eat, I wasn't in pain, but it was really just the nausea that was like really getting to me. So literally every night I would go to bed with a bowl of Cheerios next to me, because I would without fail wake up in the middle of the night and be like, I'm gonna throw up, and I couldn't get up, so that I just like take some Cheerios that would like help coat my stomach and relax, some things. So be prepared for that. And I think another thing is, I kind of thought that, my surgeon said that, healing was going to be like 2-ish weeks, which was like very true. Like my stitches like healed within like 2 weeks, but I spent like 6 weeks at my parents' house needing a lot of support. So I think be prepared for that. I kind of thought this was going to be like a 1-month ordeal, and that I was going to like slowly get better. But like I was not prepared for like this full 6-week, you're laying in bed dying, So again, prepare yourself for that. I think another thing is I do have POTS, and so the more that you lay in bed, like the more you are being deconditioned. So I think my energy was an issue. But I also have MCAS, and EDS, so just like, and obviously like when you're having surgery, it's going to disrupt your body. So I did like break out into like full hives and lots of lovely things that we love with comorbid conditions. So I just think like be prepared for a full-blown, like your body's gonna be like, what the hell is going on? But obviously when you have surgery, especially like abdominal surgery, like it's a serious surgery. And I think kind of like the last like big-ish thing is my surgeon told me, he was like, you're gonna have good days and you're gonna have bad days, which I was like not prepared for. I really thought that post-surgery, like it was like, okay, the compression is gone, you're going to feel fine, you're going to be able to eat. And for me, that has not been the case. And I think that's kind of confusing for healthy people to know, and also confusing when people know you have surgery and they're like, oh my God, how was it? And you're like, I don't know. Because I'm like 3.5 months out since surgery. And I have days where I'm not in pain at all, and I eat and I don't notice I'm in pain. And then I have other days where I eat and I'm like, ooh, that hurt. But it's nothing like it was pre-surgery. And so I think obviously there's a lot of hope, because I do have those days where it's like I feel fine. So I think it's just kind of like a hard concept to grasp when you think a surgery is going to like immediately fix things, but it's not going to. So my surgeon told me that surgery takes 3 to 6 months to fully know how your body's going to react to it. So I'm still hoping in these next 2 months I'm going to continue to get better, continue to be able to eat more and get more energy and all these things. So I'm hopeful, but even if I am how I am right now, I think I'd be okay. Like, I think I personally would be okay with having some days where I can eat and some days where I can't, and having the pain where I am at right now, because again, like, I'm in pain, but it's nothing like it was. Like, I haven't been in like total like excruciating like fetal position needing to go to the ER pain, which is nice, you know. I still have bouts of nausea. I think my nausea is something that I'm always going to deal with, but that has been like a big struggle throughout this whole thing. But as weeks progress, like, it is getting less intense, but I would still say that it is an issue. And there are some days that I wake up and I'm like, I don't want to eat a single thing today. So again, just this concept of like, you're going to have surgery and you're not going to be fine immediately after. Um, and I feel like that's something that like surgeons should tell you before you get the surgery, but I guess it's fine because I survived. And at this point, I feel like my main issues are still my bowels, my energy level, and just like overall still some pain. When I mentioned my bowels, this is like awful to be talking about on the internet. But again, Kate, I'm doing this for you. This is awareness, okay? I'm trying to get my master's degree right now, and it's either one or the other side of the spectrum, okay? I'm either so unbelievably constipated or I cannot leave the toilet, okay? And there's like no in between. And I don't know what's causing it. I don't know how to help it. Again, I think my body's still just trying to recover, and these nerves that were cut out, my body's trying to like reroute these nerves that are in my stomach. And so things are just going awry. And I think, you know, my body was so used to being at this compressed state that now that it's not, things are just moving differently. There is something called dumping syndrome where the food that you eat can like move too quickly through your small intestine, that's like too fast for your digestive system to handle. That can happen after MALS. So I don't think that's like what is happening with me, but it may be part of it. But that again can resolve itself as you like heal. So again, I think I'm just like too early in this process to know 100% like definitively like what's happening, you know. So obviously that's not awesome for me, and it's frustrating to have your body poop your pants. But if I can eat, maybe it's a trade-off that I have to endure at the moment. And when I talk about that I don't have energy, I think a lot of that was because recovery was so rough on me, and because I literally spent 6 weeks laying in bed. I work with a physical therapist. I'm still at a point where I'm like still trying to like build back some level of stamina and just like slowly regaining my energy. That has definitely been an issue. Fatigue is, I think, always an issue with chronic illness, but slowly getting that back. And my nausea, again, there's just like some days that are better than others. I think it's frustrating with a chronic illness when you wake up every day and you don't know how you're going to feel. But that's just something that I have to get used to at this point. And be grateful that like I did find a freaking doctor, because man, oh man, was that hard. I do want to say that there are not enough MALS doctors out there. Some doctors don't believe it's a thing. Some just simply won't treat it. Some don't know how to treat it. Some have never heard of it before. And that is incredibly frustrating and invalidating for thousands of people who have this condition. I mean, it is rare, but I think it might be less rare if people actually knew about it and doctors knew about it. But that's besides the point. So I just do want to say, like, if you are listening to this and you are thinking that this may be something to look at for you, continue to fight and try and find a doctor who will listen to your symptoms, who will at least run some testing. Don't stop fighting to try and find answers for your health. I don't think this doctor wants me to put his name on blast, but I'm going to. The doctor I saw was Nathan Richards. He, again, solely works with MALS patients. He has people fly across the country to see him because there aren't enough doctors who can give you surgery. And it's Terrible. And I feel like I just need to talk about insurance for a second because, oh my God, do I hate insurance. Okay. Like, what do you mean my insurance company gets to decide what doctors I want to see or not? Like, what do you mean I can't just call up a clinic and say, hey, I want to see this doctor? Like, my insurance can say, actually, no, they're not in your network. Like, what? And then even more, like, maybe a doctor prescribes a prescription. They're like, actually, this random unqualified doctor who doesn't even know you says that you can find a different medication, so nah, you don't need that one. It's like, what? Like, we are the only developed country that people can go bankrupt from their medical bills, and that is so unbelievably disgusting. And I think it's increasingly difficult when you have a chronic illness because you are constantly doing testing and constantly trying to figure out what's wrong with you. And you get one after another normal test. And every normal test comes with a bill. And these bills are not freaking cheap, okay? So this doctor that I saw, he's the only person in the state that I live in that does this procedure. So I had to see him or I wasn't getting the surgery. I called my insurance. I talked to the doctors. They said, yes, it's in network and we are good to go. So I had the surgery, came back, and then they tried to bill me $50,000. $50,000 for a day and a half in the hospital. Thank God I didn't spend 2 days. And they're trying to say, nah, actually, you shouldn't have seen him. When he is the only doctor in the entire state that I live in that does this procedure. Correctly, I should add that he does this correctly. And so it's ridiculous that I'm having to fight appeals and constantly having to like call my insurance to be like, hey guys, again, this is the only doctor I could see. Like, you have this clause that's like, if it's a specialty doctor, that this is the only person that can do this. Like, he's not actually out of my network. Like, it's just so ridiculous that we live in modern times where this is still an issue, that we prioritize money over people's basic healthcare rights. Well, we actually don't have basic healthcare rights because our Constitution doesn't have the right for medical care. Because that's bonkers, because we are stupid. Anyways, I shouldn't be so rude about this. And people are going to think I'm wildly wrong. And if you think I'm wildly wrong about this, I don't know, you should get a public health degree, because that's what I'm doing. So yeah, I am qualified to talk about this because I'm getting my master's in public health. So, shut up. Anyways, I just think it's like so frustrating when you like finally have answers and you finally think you have a solution that you have to like go through another hurdle of like insurance. And I know that I'm privileged enough that I even have insurance, and I have decent insurance, and I have parents that can support me by calling the insurance companies every other day. Anyways, besides the point. So if you are looking into MALS, if you are having stomach issues, if you are having any type of pain, I see you, I feel you, I'm rooting for you. Continue to fight to find a doctor, fight for a diagnosis. You know your body best. And even if somebody says you don't have a condition, that doesn't actually mean that you don't. Because I had doctors tell me that I don't have MALS, but they were just misinformed. I think this idea that like all doctors are experts is very misleading and simply just like not true. And you have to find a doctor who actually understands your condition, which is few and far between. Thank you for listening to another episode of the Tired Truth Podcast. Don't forget to like and subscribe. I will see you all next week. Love ya. I'm gonna go freaking lay down.